and we have a disease. But keep that in mind that the nature of the disease depends upon many different factors. As I said the other day, the viruses have also their favorite spots. Like when you come in this room, you pick your favorite spots. I've seen that in physiology. I don't know how flexible are you in terms of losing your spot, but that's a human nature. You know, you cannot get what do you call used to come. That's exactly the case with these viruses and bacteria and so on and so forth. And depending on which target tissue they have, they cause disease. You name any organ, and I also told you that in pathogenesis we talk about that different organs. The other important thing is portal of entry of viruses, pretty much the same for bacteria, fungi, and so on and so forth. So all those, your orifices and skin or breaks. So this is how these microorganisms enter, right? And then we talk about the first fight they pick up with the immune system, and then go from there. Okay. Now, if you look at the term over here, severity of disease, you compare that with bacterial system. Does anybody recall what was the term we used in bacterial system about the capability of the bacteria to cause disease? Say it again? Very good. The term is actually, you know, virulence. It's like a virus, but that is correct. So that term is basically for bacteria. So bacteria have their ability to cause disease. So do viruses, severity of the disease, right? And that is determined by many factors. In this case, it is determined, this is determined by cytopathic. You're doing what do you call medical terminology with Dr. Hussain, right?
Yeah, we are.
You took, right? And these are some of the terms that if you break up into small, cyto means cell, patho means bad, pathology. So cytopathic means to kill a cell. Right? So they have this ability, viruses have ability to kill the cells. It also depends the inoculum size, how many viruses in weight at the first place, depending upon how big that size is. It also depends upon your immune status, because we divide from the newborn to the old age. Keep that in mind that the immune system of a newborn is developing. It's not that strong, that's why they have to be vaccinated. And when you grow old, your immune system gets old as well. Okay, and then if you have any coexistent morbidity or disease, right, that will also make things worse. And then again, competence of immune system again is pretty much the same as immune status, but competence of the immune system can change depending upon your, like for example, health, nutrition, okay? And there are many factors, as we will discuss that in immunology. Immunopathology. So immunopathology is the way a particular microorganism causes our defenses to break, how severe that onslaught is. Length of time before resolution of infection. So what it means is that you heard me saying that in the past we used to say, oh, it's a viral infection, it will take a week or two, and you just have to do symptomatic treatment. So there is a length of time before we resolve the viruses, right? And I don't know whether you heard that though they're talking about COVID-19 coming in different forms with variant lengths. So what we have noticed recently, and also keep that in mind, the data is still coming. That's why I said that we really have to wait for the data as to is the common cold of this year the same as COVID? Is the common cold as bad as it used to be? So there are many unanswered questions. So that is the length of time before resolution takes place. General health of a person, nutrition, I mean, they put it separately as well. And genetic makeup of the person is also important because they think that some of the genes in a particular set of populations also affect your ability to cause virus diseases. And age. You must have heard initially when the COVID-19 hit in the first place, they thought that it was going to hit older senior people, right? And then the younger people kind of, took their chances of partying, everything, and then they found out, no, that's not the case. So age is also important. That's a part of epidemiology as well. Okay. Any questions on the determinant? This is one of the most important questions that normally come. That's why it's there in the box. So many times, as I said earlier, the boxes and the figures are your minimum competency level for any chapter. And you can go into details if you're interested, but even if you don't, you still remember what's going on. And all these things are descriptively given in the book. Any questions thus far? All right. So, let's see, where were we? And you can see while you read the book, it keeps on giving you references back and forth. Like you have to go back and forth. So this is where I want you to be on top of on your reading, because if you did not go through the previous chapters, or didn't go through the basic microbial metabolism, then you'd have to struggle. So you have to go back and re-educate yourself. So back and forth, this is kind of, and we don't have time, because we're moving at a faster pace. All right, so let's go now. So we did talk about a little bit the other day, the steps of viral disease. This is what you did. Right? Shanti? Is it good enough? Or can we go a little bit more? Good? Bad? A little bit. Okay, let's do it. All right. So now these are, there was a time when we used to draw these ourselves, but good for you because the textbooks, the current textbooks are doing this job for you. So all you need to do is just to pay attention. And I would rather redraw myself. And this is the bird's eye view of how a virus causes disease. The only difference is that I'm going to go and review through the basic concepts, and then you can read individually, like individual virus therapies and hepatitis. You pretty much find the same thing with a little bit of differences. So you can fill in the blank. Okay. Now let me give you an idea how the whole scheme is. Contagion, that was a movie I usually show in my class. It's a good movie to show viral pathogens. So we start from here. The virus, this box is us. So virus is going to hit and start infection. So let's give an example. Let's pick up COVID, for example, because I think it's easier for us. So somebody gets infected with COVID. There's this arrow over here. Now we want to find out exactly, what actually is the name of that virus, right? And how are we going to respond? So you can see host response. Let's see what else they have underneath. Yeah, and then disease, and then the time course. So we divide that in steps. For example, acquisition is how you acquire virus. And you already know you can acquire virus by all different routes that are open for viruses. It could be respiratory, it could be oral GIT, it could be skin, pretty much the same as you had in bacteria. Okay? So what happens is that the virus gets into you, you acquire that, okay? Let me go a little bit up to this. And what you see is the host response and the time. So you get a virus without knowing it. So that's the important thing. So you may have picked a virus today and you don't know that, right? Because the reason is it takes a while for the virus to move in your body and your body to respond, right? But sometimes what happens is within a day or less, depending upon what virus is, you kind of start feeling that a feeling of being unwell. You know, you feel like I'm unwell, I'm not good. There's something happening, you kind of feel there's something going on wrong. So that is in medical term we call prodrome. Prodrome. It's like nausea. I'm gonna throw up. You know, it's just I didn't use washroom. So there's some kind of early warning sign that kind of gives you an idea of, you know. And that's a typical feeling of viral infections. So we call it prodrome. It happens pretty early, right? For most of the diseases, but it can prolong. So you can see some of the diseases can prolong to 7 days. So you've been sick or unwell or not in the right mood or under the weather or over the weather or whatever for a long time. And there's nothing you can do. There's nothing we can do. You feel, you know, I don't have energy. There's something wrong with me. Right? So that's prodrome. It depends upon viruses, and it can be any time. So what is happening at that time is, and I'm just giving an example for all the viruses, is that you can see from here, what's happening here? The virus is replicating. So virus is now getting into your body, right? Like for example, it can get most commonly respiratory, GIT or skin. These are real common, and they start replicating over here. Most of the viruses. And from there, depending upon their liking, they can tag on. It is like downtown Chicago, so I want to get exit from downtown Chicago, so we have an exit, a lot of different exits. Okay, I'll take, most of you are from Chicago, so I give the example. I can take Dan Ryan North, Dan Ryan South. I can take 219 Western Suburb. I'll go a little bit of south, and I can take 55. I go further south, 50. So there are a lot of options for you depending upon where you want to go. So that's the time, and that's mostly time is like crowded as well. So you may spend a lot of time. So that's the time the viruses struggle. So what the option is the viruses think, okay, we are here at the, what's the spot they call downtown? They changed the name of it, right? The zero spot in Chicago downtown. They're here.
Are you talking about the Bean, Millennium Park?
Millennium Park. Okay, whatever. I think there's a sign that comes up. They put it by somebody's name. I saw it recently. Anyway, you know what I'm talking about. The junction. It's like a zero. Those just where the north and south and east and west stop. I think it's Main State Street and Michigan. There's a 0 point over there. Anyway, so it can go locally. You can spread locally, get a local road. It can pick up a neuronal path. The nerves are there. It can go into the blood, right? And it can go into the lymphatic. So these are the 4 choices. I gave you 5 choices for getting out of Chicago. So these are like 4 choices for getting out of the primary replication site. They can sit on a neuron, viruses are small, and then go wherever the nerves are. They can go into the blood, right? And then wherever the blood takes, so they can be kind of free anywhere. It's like more, you know, they are airborne. They can go into reticuloendothelial system, which is lymphatic system, and that system is given in physiology. We talk about that in blood. So that's where it gives you the chapter, the link. If you have forgotten, you can go back and look. These are the lymph nodes. These are the lymphatic vessels. This is thoracic duct. There are spleen. Liver is a part of that. So that's the lymphatic system. Okay? So far so good? So we divide that into primary site of replication, and then they go and find their second niches to go for the secondary site of replication. So let's see, for example, if they were to pick up on a neuron, they can go into central nervous system. What does central nervous system mean? Yeah, Gary? What is the central nervous system?
It's where the brain sends signals down to the spinal cord before the peripheral.
Brain and spinal cord. When we say central nervous system, the main thing is brain and spinal cord. So you can go into the brain, so that's what it means. Central nervous system means brain, right? So it can go over here. If it goes to blood, what are the options now? Yeah, Brianna, what are the options if a virus goes into blood?
It can affect different organs.
Any organ. They are loose. They can go where the blood takes them. Very dangerous. Viremia. So you have virus in the blood. If they go into reticuloendothelial system, what are the options? Yeah, Edwina? Same as blood, because if you remember reticuloendothelial system, lymphatic system empties into vascular system. It's pretty much the same. So you can see from here, if they go for reticuloendothelial system, they will also end up in blood viremia. Because they kind of, if you look at the circulations, there is a, if you go to circulatory system and cardiovascular system, you will see that happening a little bit late, but that's what it is. Okay? And then finally, regardless of which route they reach their destination, which is their target. Depending upon the target tissue of a particular virus, brain, skin, lungs, organ, glands, blah, 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 blah. So this is a overall schema for the viruses. Okay? Now, let's see, days can vary. Okay? And then again, typical old type viruses usually would take 5 to 7 days, as you can see. You may have some of the symptoms at the primary sites and they disappear, right? And there's a healing taking place. But this is like an ideal world, which doesn't happen. Or what may happen is that you don't get any symptoms at all other than being unwell, right? It's just like, I think there's something wrong for me, and then I start sneezing, and then I start coughing, then get a fever, right? And then that aches, then an infection, so it takes a while. So depending upon secondary symptoms, depending upon the sites, and then reverse takes place as well. Now what normally happens in terms of host response, because your body fights back, so one of the things, if you remember the other day I was saying that one of the things that you have to remember, the drug-wise gamma interferon, we talked about that. I gave you an example for one of the students who had herpes. And these are some of the things that are happening within the body, like inflammation, and we'll discuss that in detail in immunology, but keep in mind, the body fights back. Okay? So this is our overall schema of how a virus gets into the body and where the body is going to kind of respond and where it's going to take you to. Any questions thus far? these are different types of viruses, right? And this is how they cause disease, right? So these are some of the viruses, most commonly 1, 2, 3, 4, 5, 6, 7, 8, right? So these are, because remember we talked about in the chapter 36 that the viruses are dependent upon the, what we call, killing a cell, right? They don't have their own mitochondria, they're going to invade the cell. So we divide that into different kind of viruses. For example, some of the viruses are abortive. You get infected, they don't produce much, there's no effect. Some of the viruses are cytolytic, they're going to kill the cell, right? They're going to cause death of cell. Some of the viruses are persistent, they're going to come over and over and over and over again. They have this capability. Some of the viruses are productive, right? Some of them are latent. What it means is they hide, like TB, they hide. Like a person had a HIV virus, for example, today, and the virus is hidden for 10 years. Sometimes it shows up after 10 years. So that's a latency of viruses. But the problem with that is the guy who was infected with this, he may be spreading it to others without himself or herself knowing it. So that's a dangerous part, latent. Some of the viruses are transforming. They change. Some of the viruses again are DNA viruses, right? So DNA viruses are weird because they are immortalized. They never die. They're gonna kill you, but they themselves will never die. So these are some viruses. Because these viruses are very dangerous, DNA viruses. Immortal. We use these viruses to make cell lines, immortal cell lines we have in our lives. And some of them, again, retrovirus, like HIV, is also immortal. It's very difficult to get rid of that, almost not. So these are, bacteria are not like that. So viruses pose a bigger problem than any other problem that we have. Okay, and then again, these are some of the details that you can read on your own. That these are the mechanism where how they cause damage. So they are like at least 15 of them. So when they enter the cell, they're going to mess up the cell. For example, stop cellular protein synthesis, stop degradation of DNA. So they are going to play with your cell. All these problems they're going to do, and then these are some of the examples of a particular virus. So you can see, looking at their capability of causing virus, it seems that they are pretty nasty and dangerous. Okay, and all these things are then taken up in detail as we move along into DNA viruses and RNA viruses. Okay. Any question? None? So I would want you to complete the assignment that's there. It's going to take you pretty much through, and those of you who are reading in a timely manner, they can also start reading for the chapter 38 that we're going to do on Wednesday. And just for housekeeping, we'll have an exam tomorrow at 8. And make sure you bring your laptops and exam hall. Right? So there's 50 questions, including both case studies and multiple choice questions. Keep that in mind that when an instructor posts you the actual question and actual answers, you're not supposed to use exactly those questions and answers. Okay? But what I normally do is I'll do a little bit tweaking. Right? Their content matter is the same. For example, I would say, which of the following is not a blah blah blah. I will just change which of following is. So you see a little bit of difference, you have to pay attention. And why did I start doing it? Because I see in the past as well that students memorize the question, they memorize the answer. And I've seen data, they do that in 10 minutes. 10 minutes not even a reading time. So that shows me that people, some of this will memorize. Just to overcome that, and just to overcome that hassle of making sure that you spend time and read the question. So I'm gonna tweak the questions. The content will remain the same, right? So it's pretty much the same question, but the answers may be a little bit that will want you to struggle. Does that make sense? And likewise, I noticed yesterday as well that, well, I shouldn't say all of you, but some of you are still lagging on doing these Google quizzes. And I'm picking up at least, I would say, one question from each and every case. So it's in your interest that you do that, because once you do that, I don't know whether you still get an answer without doing it. I have no idea. I think you have to do it to get an answer, right?
Yeah.
Okay. So make sure these two are there. And that's pretty much it. Yeah.
For the case study, will we have to type it out like on Google Forms? Or is that multiple choice too?
I didn't get that.
For, on the exam, for the case study questions, do we have to type out our answers? Like-
Yeah, essay type questions. Yeah, of course. So there are multiple choice questions and there are essay type questions, correct?
Okay.
Yeah. But again, I put 50 questions and I gave like, normally 1.25 is the standard time for every question, but I have given 110 minutes, so you pretty much will start and then finish 10 minutes before the next lecture. That's the time that we have. So you have plenty of time. Okay, and also keep in mind that you still have to do what needs to be done, because they are counted as your participation and attendance points in terms of getting all those free points in the end. So whether you do it today, tomorrow, whenever, you know, all these Google Forms and all, they are also counted as assessment in terms of adaptive assessment and in terms of summative assessment. Okay? So far so good? Any other question or concern? I think I did look at your assignment, and I'll talk to you one-on-one. Some of you have done a very good job, and some of you have not done a very good job. Because I looked at your pronunciation, you need to practice. Not all of you, but some of you need to practice. You know, you can't struggle and stutter with that. But I've seen most of you have done a good job, and I can tell by that they did practice. Okay? Okay, Xavier?
Yep.
Yeah, all right, thank you.
All right.